Hi guys, Heather here. So I get quite a few comments from people asking what type of questions would be asked during an interview. And thinking back to when I first graduated, I can't really remember exactly, but they were questions like why you decided to be a nurse or what you like about nursing. Those are easy questions, right? Or what are your positive characteristics? Why do you think that you would make a great nurse? And that question can be kind of hard because who really likes talking about themselves? Okay, I take that back. Lots of people like talking about themselves. Or another one might be, who would I go to if I had an issue with a coworker or a patient? What would the chain of command be? Well, who would we go to first? We'd go to the charge nurse, right? And if the charge nurse didn't help us out, we'd go to the manager. And if the manager didn't help us out, we'd go to the nursing supervisor, and so on and so on. And luckily I don't have that many problems, but if I do, once in a blue moon, of course, the charge nurse usually takes care of it. Nowadays, I might be asked questions like, what are my positive characteristics as well as things that I need to work on to improve my nursing self? How would I deal with a conflict? Think of a situation where you made a connection with a patient, or what does nursing really mean to me type question. And even to this day, I'm given 4 patient scenarios and asked which patient I would see first. They kind of want to know what your priorities are. It's kind of like those nursing exam questions. There's always 2 right answers, but which one's the best? Hated that. So those are some basic questions. Every manager's different. In fact, during my last interview, we mostly talked about my resume, when I can start, and if I had any questions about the hospital. Easiest interview by far. It's also a good idea to have some questions of your own, I always like to ask, what's the nurse-patient ratio, or do you have nurses' aides on the floor? Because some hospitals are trying to phase out the nurses' aides, which I think is ridiculous, but that's another topic. So whatever you think is important to know about the unit that you're going to be working on. Well, good luck to everyone who will be interviewing. Have a great day, and I'll talk to you later, okay? Bye!